Thanks for watching Hot Flashes and Cool Topics podcast. Be sure to subscribe and ring that bell to catch all of our conversations. Now, on to the show.
One of the big things we see in heterosexual relationships is what we call the orgasm gap. And that is the persistent, they've been studying this for a while, it continues that men have more orgasms than women. Well, if somebody's getting more pleasure out of this event than the other person, don't be shocked that one person doesn't want to do it as much.
Yes. So there is only one country in the world right now that has a testosterone product for women. It's Australia. So they're a little bit ahead of us. But even though there is a global consensus statement supporting testosterone's use, all of us, if we go to LabCorp, Quest, major laboratory, I'm not talking about you buy something that we all have a testosterone level. We do. And testosterone has been proven to support all of those domains of sexuality that I'm talking about. So your sex drive, your orgasm, everything. And yet in the United States, we do not have a testosterone-only FDA-approved treatment option for women. So how do you get testosterone? You can use male formulations. We can compound it for you, or you can use pellets. The problem is a lot of people who shouldn't have been prescribing it were. And there are amazing side effects from testosterone for sex life. But then you don't want to grow a goatee and have to go to you and go get laser hair removal. I mean, that is not the goal, okay?
I'm actually anti-pellet because in Dallas, on every corner, there's a tea clinic. Mm-hmm. Yep. And who's running the tea clinic is a provider, not a board-certified endocrinologist, not a board-certified anybody. And I'm seeing, so what am I seeing? Yeah. Horrific steroid acne on the chest of women, temporal balding, male pattern balding. I mean, hair, yep. It is awful. And so, but to tell that person, remember, they're getting energy, they're getting all this other stuff, but to then wean them off is really challenging, but it's dangerous. You're putting people at risk.
It's dangerous when it's supra physiologic. So fancy word for we know what levels and what ranges you need to be in. And that was the problem, that people were dabbling where they shouldn't have. And so that's why you need to go to a reliable provider who knows what they're doing, who will measure your levels and make sure you're not undertreated, but not overtreated.
I'm a big believer in prevention, right? We wear sunscreen so that we don't get a skin cancer, or we put our seatbelts on so we don't have an injury. And so I am a big believer that sort of anyone over the age of 45 should be strongly considering vaginal hormones to prevent problems. That's not to be saying if you're now 68 and you said, oh my God, what have I been doing all this time? We've got you. We can help you. This actually will be fine. But it's one of those things is, it's never been shown to kill people. It's never been shown to increase blood clots, cancer, heart attack, stroke. It has never been shown danger. The worst thing I see happen with vaginal hormones is in the first couple weeks as the microbiome acidifies and that acid starts to increase. Occasionally you get a yeast infection and we treat it. You keep going. The microbiome fixes itself, smooth sailing.
And where we were going with your original question was, well, then what can you do about that? Hey, I don't have hot flashes. I don't have this other stuff. I'm not at risk for osteoporosis. I just have, vaginal dryness and urinary stuff. You can use topical estrogen. And by topical estrogen, I mean vaginal cream. But topical estrogen can be delivered as a cream, as a ring, the little silastic ring, as vaginal tablets. And the difference being is that the amount of estrogen that's delivered locally right there to the vagina is far less than what you would need if you were trying to deal with hot flashes. So you can take care of those pesky, painful dry sex problems, urinary issues by just using a very low dose topical estrogen. And the key to that is that it needs to be used consistently.
Right. We haven't even gone into the question you asked me, which is what we call GSM, genitourinary syndrome of menopause. It's like the honeymoon phase again. What patients describe, they're getting UTIs after sex, or they're having frequent vaginal infections, or they're having dryness, or they're having sexual pain, or what we call dyspareunia. And there are a lot of options for this that are prescription, that are over the counter. So I'll give you one example. So Intrarosa is a vaginal insert. It is hormonal. very, very little gets into your bloodstream. So most patients who aren't even candidates, let's say for systemic hormones, are still candidates for this. We just ask their oncologists if they have cancer. We ask their hematologists if they've had stroke or they've had heart attack. We'll ask their cardiologist, but most of these doctors are okay with it because those hormones are considered locally acting. And what's happening in the female genital tract or pelvic tract is that our vaginas are designed like an accordion, and they have these thick, beautiful folds called rugae, and they can stretch and accommodate partners. As we age and estrogen and testosterone decrease, the skin gets thinner. And so we can't fight off infection. There's not as much elasticity. So instead of like stretching and feeling very lubricated, the tissue gets very dry, it's thin, and it can tear with pressure, intercourse, or with stresses. And so, we recommend moisturizers, we recommend lubricants, we recommend vaginal hormones, and Intrarosa isn't the only one. I particularly like Intrarosa because it's a unique formulation, and they have, once again, that FSFI data that it helps with orgasm and it helps with arousal. It's not just helping with the dryness and the pain.
Colleen and Bridgett, we call this problem a little vaginal dryness, right? Oh, it's just a little vaginal dryness. Suck it up, lady. Use a lubricant, buy some crap thing on Amazon that's supposed to help you. You're okay. Suck it up. Y'all, this is not a little vaginal dryness. This is life-altering, life-changing. I can't wear pants. I can't wipe. I can't go out and go to the movies because I have to pee 40 times. I have changed. I can't run. I can't sleep. I can't go on long car rides. I'm getting urinary tract infections, needing hospitalizations, IV antibiotics, and they call this a little vaginal dryness.
And what are those things? Sexual function, even for women who have not had issues in the past, the vaginal dryness and thinning, the changes that are in the vulva. Some women complain of burning, itching vulvas, more urinary tract infections because your the microbiome, the bacteria that normally live in your vagina that keep your vaginal pH low, which is where it's supposed to be, changes.
Vaginal hormones reduce the risk of urinary tract infections by way more than 50%. They reduce the need for antibiotics. Now, if you have an infection, you need it often treated with antibiotics. So this is preventative. This is like putting sunscreen on because you never want a sunburn, right? This is like putting your seatbelt on because you never want to be hurt in a car crash. And so the vagina and the bladder, when they don't have hormones, it gets thin, it gets raw, it gets irritated. And then if that person then tries to have sex, penetrative sex, think of what the friction and the irritation and the inflammation of doing that on a rug burn or on a sunburn, right? It's going to create a very painful, raw, and uncomfortable environment. And so it's really prone to urinary tract infections, especially after sex. And so all of that is preventative.
So genital urinary syndrome of menopause, which is a huge mouthful, but women don't understand that women don't understand what menopause is, first of all. If you think this is just a hot flash in your periods end, you're woefully and uneducated about what's actually happening in your body. So ovarian function of hormones, both estrogen and testosterone and progesterone, go down. Other hormones too, but those are the commercially available ones, so that's why we talk about them. But they go down because changes throughout your body. And in the pelvis, it's painful sex, thinning of the vulva, resorption of your labia minora, clitoral atrophy, decreased arousal, it's a lot more hard to have an orgasm, pain with penetration. All of that is because your hormones go down. And so the other thing about it is it can happen like after your periods end. So women, they'll see me 7 years and they'll be like, I haven't had sex in 7 years. Or they'll be like, how is this menopause? And I'm like, because you don't understand it's low hormones, that the situation keeps getting worse. But very treatable. You just have to be on top of it. We think, the sex med docs and the hormone docs, we're like, vaginal estrogen is so safe, so inexpensive. And if 50 to 80% of women get these problems in their pelvis, why wouldn't you want to focus more on a preventative regimen than like, hey, make sure to go see your doctor when you can't have sex anymore because it hurts like razor blades, and then try to undo the pain cycle you created.
I've known people where they started one way and then you watch them and you see it click. And so you see it so many times, you can't unsee it. And so when you see people that feel awful, that say, my libido's gone, I have pain with sex, you say, wait a minute, stick with me here because it's not an immediate fix, but I've got you. And don't worry, I see that you can't see the future, but I do because my whole clinic's full of future you. And these 56-year-old women, these 62-year-old women, gosh, they're coming back. And every 6 months, they just say, Ruben, I'm good. Give me my refills, lady. I'm fine, right? Like, and those are my favorite visits because I sometimes have to sit there and be like, do you remember what it was like when we started working together? And they often don't. And so every once in a while, we literally have nothing to talk about but refills. And I pull out their first appointment and I read to them sort of what it was like. And it's a joy. Like, I'm addicted to my work because I see these wins every single day.